The listening part of the occupational English test has 3 parts, and in each part you hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you hear 2 different extracts. In each extract, a health professional is talking to her patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Magtanggol. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Doctor.
Good morning. Please be seated. Can you tell me about your problem?
Doctor, since last year, I've been having double vision whenever I wake up in the morning. The problem lasts for 1 hour after I wake. When I close my eyes, the double vision dissipates. Over the past month, the double vision problem has worsened in intensity and frequency. I approached a local hospital in my town, and they referred me to the emergency department for an urgent MRI to investigate for possible aneurysm. There, I had a normal MRI and I was discharged to go home. By the next week, the double vision improved, although at present I'm still experiencing constant diplopia. In the past, whenever I saw 2 objects, they were very far apart in horizontal plane, but now the objects appear much closer together. I've stopped driving. I've also discontinued my job due to the diplopia problem. There's no temporal fluctuation to the double vision. Very recently, over the past week, I've developed supraorbital pain on the right side.
Your age?
51, Doctor.
Do you have any problems with swallowing or dysphagia?
No, Doctor.
Any weakness, numbness, tingling, or any neurological issues?
No, Doctor.
Do you have any difficulty in speaking or dysarthria?
No, Doctor.
Are you on any medication or allergic to any medicines?
No, Doctor.
Do you drink or smoke?
I do not drink, but I smoke.
Is there any family history of any illness?
My mother died of a stroke when she was 90. My father had colon cancer.
Well, your physical examination report shows your BP 124/76, heart rate 101, respiratory rate is 20. Your recent MRI report shows a questionable 3 mm aneurysm of the medial left supraclinoid internal corduroy artery. There is absolutely no abnormality on the right side. The blood flow patterns are normal and there is no blood vessel abnormalities. I think you have developed a condition myasthenia gravis or other disorder. Your right lid process. You have left gaze diplopia. The pupils are equal and reactive to light. Your neurological investigation is absolutely normal. There are possibilities of other extraocular abnormalities. You have horizontal diplopia in both directions, but there is no vertical diplopia. You have monocular diplopia.
Is it curable, Doctor?
Yes, of course. I would advise you to have a craniotomy and clipping done. This is a surgery performed to treat an aneurysm. However, you have to be very careful after the surgery because a rupture may cause you to lose your vision.
I think I should go for this surgery at any cost, Doctor.
You are right, Mr. Magtanggol. Extract 2, questions 13 to 24. You hear a physician talking to a patient called Mr. Magtanggol. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Good morning, Mr. Mahigu. Be seated. Tell me about your problem.
Doctor, I wanted re-evaluation of possible idiopathic normal pressure hydrocephalus.
Okay. What's your age now?
I'm 80, Doctor.
May I know when and how you developed this illness?
Well, it started 12 months ago. I had severe cognitive impairment, gait impairment and incontinence. Actually, I was evaluated in hospital at the time with CSF drainage via temporary spinal catheter. But there wasn't any significant response for that.
Well, your MRI shows you have cervical stenosis. It seems you also had a cervical laminectomy and instrumental fusion 6 months back.
Yeah, but there is no significant improvement. I think I've become worse now than I was a year ago. Practically, I'm unable to walk at all. I use both a walker and a support from an assistant to be able to walk or stand.
Do you have any headaches?
No, Doctor. I think my memory has worsened.
What medication are you taking?
Aricept 10 milligrams in the evening, carbidopa 25 milligrams or levodopa 100 milligrams 3 times a day, citalopram 40 milligrams daily, Collis 100 milligrams twice a day, finasteride 5 milligrams once a day, Flomax 0.4 milligrams once a day, multivitamin with iron once a day, omeprazole 20 milligrams once a day, Senna 8.6 milligrams twice a day, Tylenol 650 milligrams as needed, and promethazine 25 milligrams as needed.
Your cranial nerve exam shows there is no up gaze that I can extract today. The down gaze and horizontal gaze are intact. Your gait is severely impaired. I have reviewed your CT scan of your brain and compared it to the MRI scan taken 8 months ago. Now I can see that the ventricles appear larger. The frontal hall span was previously about 5.5 centimetres and now it is 6 centimetres. The third ventricular span is 15 millimetres. I have come to the conclusion now that you have idiopathic normal pressure hydrocephalus. There is a possibility of supranuclear palsy, incontinence and urinary urgency. Although you have already had a CSF drainage via spinal catheter a year ago, I would strongly recommend that you repeat this now because there is further enlargement of the ventricles on the scan. I would also recommend a shunt surgery that would probably make a difference.
That is the end of Part A. Now, look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now look at the question 25. You hear a monologue by a physician explaining about lupus disease. Now read the question. Lupus is a chronic autoimmune disease in which the immune system becomes hyperactive and attacks healthy tissue, resulting in such as inflammation, swelling, and damage to skin, joints, blood, kidneys, the heart, and lungs. Normally, our immune system makes proteins called antibodies to protect and fight against antigens such as bacteria and viruses. However, lupus makes the immune system unable to differentiate between the healthy tissue and antigens, which leads the immune system to direct antibodies against the healthy tissue instead of antigens. Question 26. You hear a discussion between a doctor and a nurse on leukopenia disease. Now read the question.
Hello, doctor. Can you explain to me what is leukopenia disease?
Well, leukopenia is a condition where the patient has lesser white blood cells in their bloodstream, which is diagnosed with a blood test called a complete blood count. There are 5 types of white blood cells, and each of them protects the body from a different kind of infection. Neutrophils make up 55 to 70% of total white blood cells, and they fight off fungal and bacterial infections. Lymphocytes protect the body from viral infections. Monocytes are the largest of the white blood cells, and they fight against bacteria, fungi, and viruses, and they mend tissue damaged by inflammation. Basophils are involved in inflammatory reactions to allergens. Eosinophils fight parasites and play a role in allergic reactions and conditions, such as asthma. Question 27. You hear a discussion between a doctor and a nurse on different stages of gout. Now read the question.
Hello, doctor. What are the different stages of gout?
Well, there are various stages through which gout progresses. In the asymptomatic hyperuricemia stage, the person will elevated uric acid levels without any outward symptoms. The acute gout stage occurs when the urate crystals suddenly cause inflammation and intense pain. This condition is also called flare that can be triggered by alcohol and drug usage, stressful events, and due to cold weather. The intercritical gout is the period further urate crystals are being deposited in tissue. The main difference between gout and pseudogout is that the joints are irritated by calcium phosphate crystals instead of urate crystals. Chronic tophaceous gout is the most debilitating stage. Permanent damage might have occurred in the kidneys and joints. The patient can also develop tophi, big lumps of urate crystals in joints of the fingers. Pseudogout is the condition that is confused with gout. Question 28. You hear a discussion between a doctor and a nurse on different types of gum graft surgery. Now read the question.
Hello, doctor. What are the different types of gum graft surgery?
Well, there are 3 types of gum graft surgery. In the connective tissue grafts, the periodontist removes tissue from the roof of the mouth by making a flap and taking tissue from underneath the top layer. Stitches the tissue onto the existing gum tissue to cover the exposed tooth root. Stitches the flap on the roof of the mouth from where they took the tissue. The gingival grafts is preferred for the persons with thin gums that require extra tissue to enlarge the gums. In this method, the periodontist removes tissue directly from the top layer of tissue on the roof of the mouth and stitches this tissue to the existing gum area. Pedicle grafts method is often preferred for the individuals having lots of gum tissue growing near the exposed tooth. The periodontist grafts tissue from the gum around the tooth requiring treatment and partially cuts away the tissue, keeping one edge attached, and stretches the tissue over or down, covering the exposed tooth root and holding it in place with stitches. Question 29. You hear a discussion between 2 doctors about medical conditions that cause undigested food to appear in the stool. Now read the question. Doctor, please, can you explain medical conditions that cause undigested food to appear in the stool? Well, if a patient is having pancreatic insufficiency, it means they lack enzymes resulting in the inability to break down the food. Crohn's disease is a type of inflammatory bowel disease that causes inflammation in the digestive tract that can result in severe abdominal pain, diarrhea, and malnutrition. Celiac disease is an autoimmune disorder where our body becomes incapable to digest the protein known as gluten that is found in barley, wheat, and in certain other grains. If the digestive system of a person has lactose intolerance, then it becomes incapable to break down the milk and dairy protein. Irritable bowel syndrome is a common condition that affects the large intestine, resulting in pain, bloating, diarrhea, or constipation. Question 30. You hear a discussion between a doctor and a nurse about different procedures to detect blood clots. Now read the question.
Hello, doctor. What are the different procedures to detect blood clots?
Well, a D-dimer blood test will measure a substance in the blood that can determine whether there is abnormal clotting activity somewhere in the bloodstream. Cardiac biomarker blood test is a blood test that can detect damage to the heart muscle. Compression ultrasound is a non-invasive test that can be performed and is often very useful in diagnosing deep vein thrombosis. Angiography or venography and catheterization techniques in which a dye is injected into a blood vessel where a clot is suspected, X-rays are also used to detect the clot. Echocardiography uses sound waves to get images of heart and are often used in patients who have had embolisms affecting an artery, especially in patients who have had an embolic stroke. A ventilation perfusion scan uses a radioactive dye to investigate blood flow to the lungs and can detect whether a pulmonary blood vessel has been blocked by a pulmonary embolus. CT scan is often the first test used to diagnose a stroke, but is also useful for confirming a pulmonary embolus. MRI scans can be used to detect clots in blood vessels.
This is the end of Part B. Now, look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete the answers as you listen to the audio. Now, look at Extract 1. Extract 1, questions 31 to 36. You hear the lecture given by a physician on colectomy surgery. You have 90 seconds to read questions 31 to 36.
Hello, doctor. Please explain to me different types of colectomy surgery.
Well, the surgery to part of or all the colon or the large intestine is called a colectomy, and there are many types of colectomy surgeries. The type of surgery and how much the colon is removed based on the disease and the extent of damage to the large intestine. In the proctocolectomy, the colon is removed along with the rectum. The term procto refers to rectum. With both the colon and the rectum removed, the body will need a new way to dispose of stool. For most people with inflammatory bowel disease, either ulcerative colitis or Crohn's disease, a proctocolectomy also means the creation of an ileostomy. When part of the small intestine is brought through the abdomen to create a stoma, it is called an ileostomy. Therefore, the stool can be passed through the stoma and is received in an ostomy device worn on the outside of the body. The ileostomy can be temporary or permanent. J-pouch surgery is an ileal pouch anal anastomosis, which is done along with proctocolectomy or after proctocolectomy. In this surgery, the last part of the small intestine, called the terminal ileum, is sewn together in the shape of a J and can then hold stool for a period of time, serving like a rectum. Ileoanal anastomosis is done to restore the ability to move stool through the anus. In this surgery, after the rectum and colon are removed, the small intestine is connected directly to the anus. In the total colectomy surgery, entire colon will be removed. Unlike proctocolectomy, the rectum is not removed in this surgery. A total colectomy with partial or complete rectum left in place may be done in certain cases of either Crohn's disease or ulcerative colitis. In a partial colectomy, part of the colon is removed, and it may also sometimes be called a subtotal colectomy. A partial colectomy may be done for certain patients with Crohn's disease, while it is also done to treat colon cancer or diverticulitis. This surgery is never done for the patients with ulcerative colitis, since the disease will often recur in the healthy section of the colon that is left. In hemicolectomy surgery, either the left or the right part of the colon is removed. In a right hemicolectomy, the cecum, ascending colon, and a portion of the transverse colon are removed, along with the appendix is attached to the ascending colon. Whereas in a left hemicolectomy, the descending colon and part of the transverse colon are removed. In this surgery, typically the healthy sections of the colon are connected together. Therefore, an ostomy is not required. Now, look at Extract 2. Questions 37 to 42. You hear the monologue of a physician giving a lecture on ankle fractures. You have 90 seconds to read questions 37 to 42.
Hello, Doctor. What are the types of ankle fractures?
There are different types of ankle fractures, and treatments vary significantly based on the location and severity of the injury. When a broken ankle occurs, the injury may be to the end of the medial malleolus, called tibia, or to the lateral malleolus, called or both. There are many types of ankle fractures, and let me explain you about certain common tight ankle fractures. Lateral malleolus fractures is the ankle fracture that involves only fibula. Most of the lateral malleolus fractures can be treated without surgery if the ankle joint remains stable. A surgery is recommended in case of an unstable joint or the ligaments are damaged. However, the hint for surgical recommendation is when the fibular fracture is within 4 centimeters of the end of the bone. In such case, the fracture can be treated non-surgically if there is no injury on the inner part of the ankle. Medial malleolus fractures involves only tibia. This fracture occurs to the bone on the end of the tibia, which is called the medial malleolus. An isolated medial malleolus fracture is very rare compared with an isolated lateral malleolus fracture. Generally, a displaced medial malleolus fracture is treated with surgery. Bimalleolar ankle fractures involves both fibula and tibia that occur when there is an injury to both the inner and the outer side of the ankle, always resulting in an unstable ankle joint, and surgery is to be recommended for most of the patients with this kind of fracture. Even if the fracture heals without a perfect positioning, the ankle joint alignment will remain disturbed and could result in accelerated arthritis of the ankle. Even after a surgery, ankle cartilage can be damaged at the time of the fracture, resulting in arthritis. Therefore, a proper diagnosis and repair of these fractures is essential to avoid the chance of long-term problems. Although a bimalleolar equivalent fracture involves only fibula, there is also a tear of the ligaments on the inner side of the ankle, resulting in instability of the ankle joint. Therefore, a surgery is essential. Trimalleolar fracture involves both fibula and tibia like a bimalleolar ankle fracture. However, the bone in the back of the tibia called the posterior malleolus is also fractured. At times, if a large fragment of bone is fractured, a surgery is inevitable. Posterior malleolus fracture involves only tibia. This is a rare injury in isolation. Fractures of the posterior malleolus generally occur in association with bimalleolar ankle fractures. In such case, the injury is called a trimalleolar ankle fracture. Mesonerve fracture involves both fibula and tibia, which is a less common injury. However, this injury needs to be diagnosed thoroughly, as there are chances of missing this injury. In this type of fracture, the bone is injured on the inner side of the ankle, called the medial malleolus. The force of this injury passes through the large ligament that connects the two bones of the leg, called the syndesmosis. Since the damage is caused to this supporting ligament, the ankle becomes unstable, and most often a surgery is recommended. This is the end of Part C. You now have 2 minutes to check your answers.